A breast cancer diagnosis can bring emotional distress and spiritual unease. At Community Cancer Institute, chaplain services are helping patients find strength, and one chaplain has already made a difference in the life of a survivor. Yuliya Kochkina was diagnosed with breast cancer in 2024. At first, the news was overwhelming. Looking for support, she was referred to Chaplain Services, where she met Chaplain Kevin Rhamie and found the strength to move forward.
Honestly, fall in love with Kevin. His way of working with people, his way of listening, and eager to help, eager to share the stories. And when you hear from him that you're not alone, actually,
Chaplain Kevin and the Chaplain Services team provide their support in a respectful and non-judgmental way, no matter a person's personal background.
Also, recognize that Pastor Kevin was really respectful to my religious beliefs, and that was I also acknowledge for myself that he didn't force me in the religion way, or didn't tell me, hey, let's just pray, or do just only this specific thing. No, he said, if it's good for you, we can follow it. If it's not, we can live it.
Chaplain Kevin has spent more than 20 years in healthcare chaplaincy. He began helping Yuliya cope with her diagnosis just a few months ago.
So she was referred to me by the physician for experiencing anxiety. And so once I met with her and got her background and history and understood what her emotional distress was, hers was just the anger. And while she was still a mom, while she was working, while she was going to school, dealing with all of that while dealing with her diagnosis, she was upset with what life threw at her. But she didn't know how to deal with it. And I was able to help her to deal with it using cognitive behavioral therapy.
Chaplain Kevin says there are several misconceptions about chaplaincy, but the goal is simple: helping patients, loved ones, and families cope with and process a diagnosis.
Most of what we do is non-religious. It has to do with helping the individual cope through their health crisis. And whatever religion they have, whatever coping mechanisms they have or have used in the past, we utilize those and help them and remind them of those to help them, to assist them in coping.
And also Kevin explained to me that it's not only a service for the patients, but also for the family, for the caregivers. So he told me that actually, my kids and my husband, if they are willing to talk to him and if they need that help, he can also be with them and provide them that help that also was new to me.
With 2 decades of chaplaincy work, Chaplain Kevin says the job has been rewarding.
Most rewarding part of my job is to see the before and the after. See somebody who comes to me just kind of almost falling apart. And in a matter of sometimes just 3 sessions, to see all of that resolved. And behind them and moving forward, how they can now cope and know the triggers to whatever emotional stress they experience. And that's so rewarding.
And Yuliya says her connection with Chaplain Kevin has made all the difference, helping her find hope in the middle of her fight.